72-year-old man goes to the emergency department. He's got some fatigue and exertional dyspnea and a sensation of the chest tightness that's worsened for the past 2 months. Denies fever, recent travel, or any of that good stuff. On examination, we got pretty normal stuff, a little bit low blood pressure here, respiratory rates 18, JVD is mildly elevated, heart sounds are distant. Ooh, heart sounds are distant, super important. And I wonder if we have enough just to go there. Yeah, okay, low voltage QRS confirms large pericardial effusion. Man, they did not have to tell you that much. Tamponade. Well, here we go. And we perform a pericardioentesis, and what do we find in the fluid analysis? Okay, so we actually have a lot of information that they just gave us here. What this question is testing you on is a couple things like fluid around the heart. What is that? A pericardial effusion. Also, this is an older man who used to have like prostate cancer, and so maybe he's like immunocompromised a little bit, and there's no signs of infection, and there's no fever or cough. And so what is causing all this fluid, guys? What's the big deal? What do you guys think? So what's happening is whenever cancers like prostate, or you might see this in a breast cancer patient, he's got a mastectomy, they can lead to leakage, even years later, leakage into the sac around the heart, and that causes a fluid buildup. And this fluid is often bloody, and it's filled with cancer cells. And so what you'd see is a hemorrhagic fluid with atypical cancer cells. That's definitely what we're going to be seeing here. Old cancer and new heart fluid makes us think of cancer spread, a malignant pericardial effusion. That's the bottom line here. Now let's look at this one. A purulent fluid with numerous neutrophils and gram-positive cocci on the gram stain. That's bacterial pericarditis. Due to a gram-positive cocci stain would make us think of Staph aureus, and usually present acutely with fever and also with sepsis. And so they don't have an acute illness, and so the gram-positive chains and clusters, that would indicate like a streptococcal, but that's not what we see in this patient at all. They don't have acute illness or like infection or surgery. Let's look at this one, milky fluid with elevated triglyceride content. So that the milky fluid and triglyceride that's elevated, you could see that with lymphatic obstruction or trauma to like the thoracic duct, and it'd be common in people with mediastinal tumors or surgical complications. Definitely not prostate cancer, or especially if he has no recent procedures. So that'd be like a procedural effusion and lymphatic obstruction or trauma. So that'd be the milky fluid with the triglycerides in it. Serous fluid and positive tubercular PCR. This is going to be like your tuberculous pericarditis. That's the lymphocytic, rich, straw-colored effusion. And that would have fever, weight loss, night sweats. The classic little thing you think of with TB exposure: fever, weight loss, night sweats. And so it's not going to be that, especially common in endemic areas. And this guy's older. He's just a lower risk demographic for that. Straw-colored fluid with normal glucose and no malignant cells. That'd be consistent with your idiopathic and viral pericarditis, and that would typically follow a viral urinary infection or GI illness maybe, which this patient does not have, right? So the viral effusions are usually small, they're not hemorrhagic, and they don't show these malignant cells. And so that's not going to be our answer. Idiopathic, definitely not what we're seeing here. We just see old cancer that got reignited, and now it has some atypical cells in it. So the pathophys recap here is that there's a malignant pericardial effusion due to a direct tumor extension, either through the breast, the lung, the prostate, lymphatic, and spreads to the blood like the prostate and lymphoma. And the fluid is going to be bloody, and that's due to the tumor-induced angiogenesis and the capillary fragility. And so if you were to analyze this, you'd see elevated LDH and proteins and atypical cells. And you also may have this progress to like a cardiac tamponade, and that would be your Beck's triad of hypotension, so low blood pressure, your JVD, and also your muffled heart sounds, the distant sounds, right? And that's what we need to know about this question for pericarditis, pericardial effusion, and especially after cancer, and the malignancies can spread through this way, through the blood. All right, well, we'll see you guys in the next video. Hopefully this is helpful. If it was, like and subscribe. We'll see you in the next one.